Welcome to the Ask the Expert Show with local celebrity host Steve-O. Sit back each week while Steve-O educates you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O with today's expert in their field.
Hey, good afternoon. It's 5 o'clock. You know what that means? It's time for Ask the Experts. This next show that we're doing is on dental implants. So for all you people who texted me last week, or I guess it's been 3 weeks ago, we're going to answer your questions today. And let's go around the room. We got three of the doctors in today. Let's start off with Fred.
How are you doing,
Give
Steve?
us your name and tell us about the practice.
My name's Fred Norkin. I'm periodontist. Actually, all three of us are periodontists. We're board-certified periodontists. We practice here in Boca Raton. Practice is one of the oldest periodontal practices in Palm Beach County.
Let's stop you just a minute. Not everybody is board-certified.
That's right.
So tell everybody what the difference is in board-certified and just someone hanging their shingle up saying, we do dental implants.
Right. Well, it's a very good question. So as a periodontist, we've all done specialty training, specifically in periodontal treatment and dental implants, gum and bone surgery, dental implants, dental alveolar surgery. In our case, all of our doctors have actually done two separate residencies. So we've all done residencies in either general practice or advanced restorative work, and then after that went on to do a second residency in periodontology, where we not only earned a certificate, but then we all went on and became board certified, which is my partner Jeff Ganellis always describes it, and he's right, as the last hazing ritual. But it really distinguishes those who go on for that final certification. It means that you've done extra work to show that you're incredibly knowledgeable and keep up with all of the latest studies in our profession and in our specialty. The difference between what we do, what we offer as specialists, and the typical general dentist who takes a weekend course or a series of courses.
Please tell me it's not just a weekend course.
Sadly, sometimes it is, where they essentially go and they try to become equally skilled. It's very difficult to pick up what we learn in 3 years, or in our case, 4 years, because we all did two separate residencies, 3 to 4 years of training in a weekend, not to mention the volume of work that we're able to do as specialists is able to distinguish us as well. So the bottom line is experience matters.
Okay, so we're going to go around the horn here. So we have a new dentist from the practice, Liliana.
Yes.
How long have you been with the practice for?
I started in August 2016.
I love her Alabama accent.
Alabama.
From the deep south.
The south.
Yes.
And I've been happily since then working with them. Very happy.
That's not what you said this morning on the phone. That's okay. And who I called the professor, because when this is our second show, you explained everything that even a guy like me can understand it. And I think that's important. So, Jeff, tell them a little bit about yourself.
Well, I'm the oldest guy in the practice here, but
and you taught before too.
And we all still teach. We all give lectures. We all are writing papers and participating in clinical trials for new research and new products. And it's part of our practice is we're always looking for that next great idea. And we have introduced that next great idea many times over. It was immediately loading implants in the late 90s. It was different types of implants. It was different type of regenerative materials, different ways to save teeth, because we still firmly believe that if you have teeth and they're worth saving, that we're going to do everything we can to save those. But if you need to replace them, then we're also really expert at implant dentistry.
Well, I'm going to knock out your questions first, and then we'll get into it deeper, and whoever wants to answer the questions, and I kind of relate them to you. Our biggest question we had after your show was about one-day teeth, because not a lot. I mean, my sister had implants, and it took her like 3 months from the time they started.
Well, we've been doing this. My first patient, who's still around and still has his implants done, first patient was in 1995, where we placed his implants and put teeth in the same day. So that's 23 years
They
that
still
we've
have
been
the
doing.
same implants.
Same implants, same teeth.
Wow.
He's not in as good as health as he used to be, but he did it, and then his wife did it in 1997, and she's still around. She's still in good shape. And it's something that we have evolved. Fred mentioned the idea of experience, and this is part of what we do. We understand why these things work. We understand the biology behind it. We understand the surgical techniques, and we've developed this expertise over the 20 years. I've been in the practice for 28 years at this point, but the knowledge that I developed is shared, and it's updated by our newest doctors like Lily. Fred's been there, and he's done as many of these cases as I have. Sammy is in the office now, and he's finishing up with somebody. But this is something that we do, and we're really good at it. And there are many practices out there that are advertising hard right now. They're putting lots of dollars in telling you how great their services are and how they do it all under one roof and how unique that is. Well, we've been doing it since 1995, and I defy any of the other practices to show those kinds of results. And they're not necessarily specialists either.
This is all you do. Is that right?
We just do periodontal
You don't do like
periodontics.
Invisalign or any of
No.
that? Okay, so we've been in this business for 8 years. One thing I've learned is if you're with a practice that basically this is all they do, you got a much better chance of success than someone who's got 10 different things they do, because this is where you concentrate your business at.
Well, we have all the tools and the technology and the instruments and the materials that have almost ever been made to be able to solve problems. And we have tremendous resources to solve problems. If you don't do this all day, every day, you just don't have that ability. We do.
How do you do it in just one day?
It's magic.
It's got to be.
Well, some people call it magic.
So essentially what we're able to do is, if necessary, remove the failing teeth, at the same time clean out any
So
infection.
extractions first.
If need be, we'll take the teeth out same day. We'll clean out the infected tissue. We'll make sure that the new foundation, the bone, is still as healthy. And then we can place the new tooth roots, meaning the dental implants, at the exact same time.
Wow.
And in those instances, we're able to maximize the stability that we get. And we can do that because, as Jeff said, we have technology. Most importantly, we have cone beam CT scans that allow us to see three-dimensionally through somebody's head. What that means is, imagine having an apple, and you can cut the apple in half. You can open up and look at the inside of the apple. That's what we can do with your jaws. We can do all that before we even touch you. So all of us actually do the surgery without the patient there. We do the surgery in advance on a computer. And by doing that, we now know exactly what we're going to do and how we can replicate that in the mouth at the time of treatment. So it means that we can maximize what we have. So if somebody says, I was told I don't have enough bone, or I'm not a good candidate.
Which we did. We got one that said, I was told I didn't have enough bone.
Right. And so those people are usually mistaken. I can tell you in my 17 years in this practice, and Jeff's 28, and Lily's several years with us, I can't remember anybody that we've sent off and said, you know what, you just don't have enough bone.
Wow, that's amazing. So when someone comes in, they sit down with you first, you explain the process to them. It's not always the one-day teeth, though, is it?
No. You know, what's interesting is the fact that there are certain groups that you may go see for dental implants, and everybody's getting a size 9 shoe.
Okay.
Now, I don't wear a size 9. I don't know what size you wear.
I
but
don't wear a 9.
We all wear different size shoes. And yet, there are a lot of groups that are just offering one treatment for every single person that walks in the door. That's not right. There are so many other treatment options that are available. And so what we try to do is customize the treatment to the patient's needs, to the patient's desires. And as I said, using technology, we're able to pre-plan all of our work and then see what treatment is best for that patient. Not necessarily what treatment we offer that's best, but what's best for that patient. And that's really important because there's a real distinction between the only treatment that somebody offers or finding the right treatment remedy. And as Jeff pointed out, sometimes that right remedy might be keeping teeth and saving and fixing teeth or replacing
So you
them.
can treat periodontal disease.
We do it every single
Might
day.
not necessarily mean implants.
And those are actually some of the most gratifying cases. I know Lily talks about a case that she did recently, and I'll let her take over for this, but some of the most important or most gratifying cases that we do are the ones where we don't take teeth out.
You
where we
save
actually,
them.
Right.
Mm-hmm. I love perio. I love saving teeth, and as we all know, if we cannot keep them, because in some instances we can, we have a great tool which are dental implants, and it's a great tool, but teeth are also great. They are the best thing that we can have. We have them and we maintain them. As a periodontist, I take so much pleasure to bring the periodontal health, to bring your gums back to where they are supposed to be and keep your teeth. Some people come telling me, I was offered a full extractions and dentures, can you help me? And that's, for me, the best pleasure I get from my career. Help you get...
Where were you guys at 10 years ago? I've never admitted this before, but I had the surgery. And back then, it took a long time. It wasn't in one day. But you know what? My mother, I keep hearing her, got to take care of your teeth when you're young. We go, eh. So I think it's amazing what you guys do. And you're right. You don't realize how much those teeth mean to you till you lose them. And then to have a way to get them back, I mean, it's like God sent. So I think what you guys do is just, it's amazing. Tell me, on the periodontal disease, do you do the cleaning?
We have a group. Sometimes we do it as doctors when the procedure is advanced. We also have our hygienists when you come to the office and the disease is at the beginning or is mild, that we can rely on our team of hygienists that are wonderful too, and they help you to maintain, they teach you how to maintain your teeth. And
what if you don't?
If you
What if someone's got periodontal disease and they don't take care of it? What's the end game?
Unfortunately,
they're going to lose all their teeth?
You lose them, but you know what? We educate you. We are there for you. And believe me, after you go to our office and you are in our team with the hygienists and the doctors, we get you back to health if it's possible. As I said, sometimes that is not the option, and that's why it's beautiful to have the option as the implant.
Yeah, there's a book out now. A doctor just wrote a book, and he said one of the worst things you can do is not have healthy teeth. He was talking about overall health, and he said teeth was number one.
Well,
and yeah, now that you're saying that there is a connection between health and oral health and overall health with cardiovascular disease, with preterm birth, all these things that you think are isolated. No, your teeth are part of your body, and it's like having an infection in other part of your body. If you don't take care of that, it's going to affect your heart, it's going to affect your brain, it's going to affect any other part. So it's a connection. And
it connected me. I became a radio host, so I understand about it affects your brain.
One of the more interesting pieces of research that's come out is, as Loli mentioned, periodontal disease or uncontrolled periodontal disease can lead to cardiovascular disease. One of the ways that manifests itself is in erectile dysfunction, and that there actually
from not taking care of your gums.
From not taking care of your teeth, you can't have an erection. So
wow.
That's a pretty
Only
odd
men,
statement.
That's next week's show, by the way.
That's only men.
But there is a connection. And there's a connection to diabetes. There's a connection to Alzheimer's disease. There may be a connection to pancreatic cancer. All of these things are being tied to inflammation in the body. And infected teeth is one of the places that this inflammation comes from. So also untreated root canal problems cause the same thing. So taking care of your teeth is important for your overall health.
You know what? Anybody, I'm going to tell you, anybody who goes the denture route, I'm telling you, the dental implants are the way to go. What a difference in dentures and the dental implants. Because you can't eat everything with dentures.
Well, dentures are a great replacement for no teeth.
Okay.
But they're not a replacement for teeth. And the reality is that nobody wants to sleep next to their teeth at night.
Yeah.
And it's more about self-confidence, comfort, lifestyle. People that live in this area, in South Florida in general, regardless of age, very active. We're very aware of our bodies. We're very aware of taking care of ourselves and health and going to the beach and being outdoors. And when you have an unhealthy mouth, that is absolutely in direct contrast to the lifestyle that we all live down here. We have the greatest weather in the country. It's sunny 12 months a year. It's warm 12 months a year. We're outside. Most of us exercise regularly. People are looking to take care of themselves completely, and then you see somebody smile, and the smile doesn't match. And we see people like that.
We actually have a friend listening today. She's missing one tooth, but it's towards the front.
Sure.
The way she smiles is not normal because she's trying to hide that tooth. I said, would it be better just to get an implant done than have to watch how you smile?
Sure. It's self-confidence.
Yeah, absolutely. We got to go to break. We come back. I want to give everybody your phone number.
It's 561-912-9993.
The name of the practice is South Florida Center for Periodontics and Implant Dentistry. We will be right back with more.
The phone number you have on there is our fax number.
Yeah.
We got to change that.
Get your smile ready for summer. Are you missing teeth? Do you have loose teeth? Can you bite into an apple? Is your smile ready to hit the beach this summer with confidence? We all work out and try to look great since we live in paradise. You need a smile to match. The South Florida Center for Periodontics and Implant Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants, and we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did.
And we're back. We're here this afternoon on the Ask the Experts show. The name of the practice is South Florida Center for Periodontics and Implant Dentistry. And we've got Jeff, and we've got Fred, and we've got Liliana. They're all dentists there at the practice. Where is the practice located at?
We're on Military Trail, 3020 North Military Trail here in Boca Raton. If you dropped a pin right in the middle of Boca Raton, Florida, you'd probably hit our office dead on.
So you're close to Military and what?
We're between Banyan and Potomac. That's just south of Yamato Road, but north of Glades Road.
Okay. You got those gated communities down there. You got the Polo Club down there.
We've got a few.
I bet you've got some patients from there, too. So we're talking about dental implants. Jeff, tell us, when a patient calls you and they come in, how long is the consultation usually?
We schedule an hour for that first visit.
Okay.
And during that appointment, we will go over your health history, make sure there's nothing that interferes with possibility of treatment. We'll do an exam. We'll look at your x-rays, or we'll take some new ones, or take the 3D scan that Fred was talking about. And then we'll sit down and if it's pretty straightforward, we'll go over everything with you at that time, make some recommendations, and you're usually in and out within an hour. If it's more complicated, if we have to coordinate with physicians or other dentists or get some other information, we may ask you to come back to have a conversation. And I often tell people that I can have a fast conversation with you now, or I can have an intelligent conversation with you next time. What would you rather have? And more often than not, it's the intelligent one next week. We don't charge for that second consultation, and frankly, it's very important to us that you understand what we're saying and that we all agree on the same plan and budget and everything else. And if we don't, then we will keep meeting and keep going over things until we have a plan that we all agree on. Because it's foolish for us to try to force someone into a treatment plan they can't afford or don't want.
It's a big decision.
It could be.
Yeah.
It may be very easy. It may be inevitable, or you may have some options. Everybody's different, and that's why we take a lot of time, because we We really try to individualize what we do.
Does insurance cover this at all?
Some insurance will cover. It depends. We don't know, but we try to help you as much as possible. If you have dental insurance, we try to file for you if we are not a participant of the insurance.
So there are some insurance companies.
Absolutely,
dental
yeah.
insurance.
We try to help the community, and more they are using the dental insurance. So we want to help people, and that's one way of helping. And if we are not a provider, we cannot provide every insurance that exists in the world, but we try to help you, and sometimes we honor the insurance fees if we can.
Jeff, you answered it so well last time about pain, because that's people think about, is this painful? Because some people don't have it done just because they don't like pain.
Well, this procedure sounds like it ought to be awful. We're drilling. It sounds like you're just doing this awful procedure, but the reality is that there's very little pain. Most of our patients don't take more than Tylenol or Advil or over-the-counter pain medications, and occasionally they will take some Tylenol with codeine or something like that for a couple of days afterwards. But when you understand why implants work, you sort of understand why there's not much pain. Implants work because they attach to the body. They attach to bone cells. And we have to be very delicate when we manipulate the gum and also the bone so that the implants will attach. Well, one of the side effects of that is there isn't much trauma and there isn't that much pain. There usually isn't that much swelling. Occasionally there's a little bruising, but ordinarily it's more swelling and maybe some bruising, but no pain that follows most of these procedures.
That's amazing.
And it's true, it's shocking, but it's even true when we do the full mouth cases. I have patients that come back a couple of days later and they took nothing.
What about going back to work?
We encourage that.
Next day?
If you feel up to it, do it. We don't encourage marathon running the next day.
Right. And what about, is there a certain diet after they've had it done? Do they have to stick with softer liquids, or can they have whatever they want?
We suggest, if you're doing a large amount of work, then we suggest that you have a softer diet, probably for about 4 to 6 weeks afterwards, and that allows the implants to heal in completely. If you're just having a small section done or one tooth, then it's easy enough to go on a normal diet, but just chew on the other side or stay away from it.
When can you have one of those red candy apples? Don't have to worry about that tooth sticking in there or not?
You may want to use your head and be a little bit rational about things like that.
Could regular aspirin work too?
Sure.
For the pain? Wow, so there really isn't much pain.
A lot of times it can.
Wow.
The hardest part, if I could just jump in for a second, has to do more with patients' fear and anxiety.
Not knowing. That's
exactly.
Fear.
It's always the fear of the unknown. And so what Jeff is saying is absolutely accurate. Afterwards, patients have very little discomfort. And that's how we describe it to people. The hardest part, I always tell them, is walking in the door. Sometimes walking in the door for the exam and the consultation, because that could take them a while to build up to. And once they've committed to doing it, sometimes just coming back and getting across the threshold, and we'll help them with that. We offer a range of sedation options for patients that are safe and effective. This allows people to do what they know they have to do and they want to do in a safe and effective manner and alleviate the anxiety. Sometimes they'll sleep through the whole procedure with IV sedation. Sometimes it's oral sedation or nitrous oxide, meaning laughing gas. It depends. But once again, we will customize and tailor that to the patient's needs. Many of our patients go through treatment without any sedation. That works for them. But for the ones that need something or a little help, we can do that, including bringing in an anesthesiologist that can put them to sleep and monitor them. It's a board-certified dental anesthesiologist. That's all he does. So we have a number of options that we can offer to our patients to help them get through what's really the most painful part, which is the anxiety, not necessarily the work itself.
You have any good stories?
If I could just follow up on that. I think the hardest thing is not walking in the door. The hardest thing is picking up the phone.
Right.
It's picking up the phone to make the first call. That's tough.
Is that the 561-912-9993 number?
That's the number, but that is the hardest thing. Once you get over that, and then you get in the door. It's easy from there.
Yesterday, when I called my patient after the procedure, she's like, Dr. Lily, I have no problems. It was my brain that was giving me the problem. It was my fear. But I could do this again tomorrow if you want me
And how
to.
many implants did she have
placed
put in?
3 implants on her, yes.
How many?
We extracted 3 teeth, and we
Okay.
placed 3 implants, and all in one day.
That is amazing.
And she had no problem, no problem.
Wow.
But of course, the anticipation, the unknown. When the patient,
I want to see when they put that mirror in their face and they say, wow, that's got to be amazing feeling.
Yes.
Let's talk about your website, because you got a great website.
Thank you.
What is the website address?
The web address is www.flsmile.com.
Okay. When I got these text messages, I don't know how this is in your 5 women and a man. Is that what the demographics usually are, or is it more, do you see more male?
Well,
I was going to say the men probably need it more, but they are more reluctant to pick up the phone and call.
Why is that, do you think? The pain factor?
No, because they're generally bigger wimps than women are.
Oh, okay.
But that's true in healthcare in general. More
Okay.
women make doctor's appointments than men do, although the men probably could use it more.
it's about 60-40, 60%
Well, see,
women.
mine was even more than that. We
Right.
had 5 women and a man.
Right.
That actually went to the trouble to text us. And then one we just got, oh, you know what? One was about whistling. Was that yours? They have implants and they whistle when they talk?
That sounds like more of a restorative issue, which can often be very easily remedied by seeing their restorative dentist, the person that makes the teeth, the permanent teeth at the end.
Now, do you make the teeth right on the property?
We make the temporary teeth for patients, but not the permanent teeth.
Okay.
So just as we were talking about earlier, as far as specialties are concerned, our specialty as periodontists, as board-certified periodontists, is that we're really surgeons by training. And so we will take our patients all the way through their temporary teeth that don't come in and out. They're usually screwed into place and don't come out. When it comes to the permanent teeth, then we work in concert with their restorative dentist, or we refer them to a restorative dentist if they don't already have somebody. So we work with a number of very competent doctors.
I got to ask, as my last question, why should I go to you instead of anyone else? Who wants to answer that?
I'll take it because we have incredible integrity, and we believe in what we do. We do it well. We take it really seriously, and we're in it not to make a buck, but to really do good for our patients.
I
make them
totally
better.
believe you. I'm sold. The name of the practice is South Florida Center for Periodontics and Implant Dentistry. The phone number is 561-912-9993. And they're going to be back with us again next month. It goes by fast.
Very
No,
fast.
it's very fast. Anyway, we're going to go to break, and we come back. We're going to talk about bankruptcy. Yuck.